I offer up an amendment that would require the Medicaid and CHIP Payment and Access Commission to produce a study on the effect of the Medicaid title on out-of-pocket costs for services to prevent and screen for and treat cancer. The amendment would require the study to focus on individuals eligible for Medicaid or CHIP under the eligibility rules in effect on April 1st, 2025, and the health outcomes for such individuals. As a local elected official for 15 years, I was elected to take care of the most vulnerable populations. Those that couldn't afford or have access to health care during that 15 years would come to my office. We had 142 caseworkers that would work with individuals that were the most vulnerable populations. That being said, this is in my wheelhouse, and it's worth being here through the middle of the night marathon to make sure we're fighting for access for health care for all individuals. I specifically choose this amendment for cancer because each year I meet with NIC, which is Northern Indiana Cancer Children, and what their 300 families that they have provided for are worried about is losing access to health care for their children, losing access obviously for individuals with cancer as we reduce the numbers of people who are on Medicaid. I also, as a local elected official, have a very unique position where part of the process was work requirements. Well, what happens when a family member has an illness that is going to cause death? People stop working to take care of that family member. And if you have to provide proof each 6 months while you are facing a crisis in your family, that is going to be the last thing you do, which puts your health care at risk. And so ultimately, why I'm here offering up this amendment is because what my colleagues have talked about, the features and benefits of your bill are ultimately the most wealthy and corporations are going to get tax cuts, where the most vulnerable are going to be punished. And ultimately, I leave with this message. The American Cancer Society, if we can agree upon one aspect of life, Chairwoman, the American Cancer Society has an ad on social media saying just to be specific, 1 in 3 children will have cancer, 1 in 10 adults with a history of cancer have Medicaid for their care. They're advocating against this bill because they know the impact of it. So ultimately, today, what I'm asking for is support of this amendment to make sure that the most vulnerable of populations have access to health care. And with that, I yield back.